Tenapanor is utilized to address irritable bowel syndrome with constipation. It functions by boosting the fluid in your intestines, which helps to accelerate the movement of food through your gut. This medication may also improve stool texture and alleviate abdominal pain and discomfort. It is essential to follow the prescribed dosage and to take this medication at the same time each day for best results. Before starting your Tenapanor medication, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually twice a day, once before your first meal of the day, and once before dinner. Remember to swallow the tablets whole and not to crush or chew them. Using this medication regularly will help you get the most benefit from it. To help you remember, take it at the same times each day. If your condition does not improve or gets worse, be sure to inform your doctor. If you experience diarrhea that persists or worsens while taking Ibsrela 50 mg tablet, it's important to inform your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, if you do experience severe diarrhea or any other serious side effects, it's crucial to stop taking the medication and immediately contact your doctor. While it's rare, a serious allergic reaction to this medication can occur. Seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you experience any other effects, be sure to reach out to your doctor or pharmacist for guidance. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medicine should not be given to children under the age of 6. It is also not recommended for use in children ages 6 to under 18 due to the risk of serious dehydration. It is important to consult with your doctor for more information. Before starting Ibsrela, it's important to let your doctor or pharmacist know if you have any allergies to this medication or any other substances. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of stomach or intestinal blockage. If you're planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication if clearly needed. It's important to discuss the potential risks and benefits with your doctor. It's currently unknown whether this medication passes into breast milk, so it's important to consult with your doctor before breastfeeding while using Ibsrela. When taking Ibsrela 50 mg tablet for irritable bowel syndrome, it's important to be aware of potential drug interactions. Certain medications may affect how Ibsrela works or increase the risk of side effects. It's essential to keep a list of all the medications you use, including prescription, non-prescription, and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medication regimen without consulting your doctor first. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. This medication is for your use only. Do not share it with others. If you forget to take a dose, just skip it and take the next dose at your usual time. Don't take double the dose to make up for the missed one. When it comes to storing Ibsrela 50 mg tablets, it's important to keep them in their original container at room temperature, away from light and moisture. To help prevent moisture buildup, it's recommended to keep the desiccant packet in the tightly closed container. Avoid storing the medication in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Ibsrela 50 mg tablets, it's important not to flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure of how to dispose of the medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.